So recently a lot of evidence is coming and lot of talking is happening about role of iron deficiency in heart failure patients. Iron deficiency is being talking about as a separate clinical entity which is different from iron deficiency anemia. What is your say on this aspect, sir?
It's a very good question. See, firstly, repeat hospitalizations after heart failure are emotionally and financially and socially very damaging to the patient. So, I run the whole heart command center is under my care at the Medanta, the Medicity, and I can tell you that even if there is something which is 1% that I can help the patient not coming back with repeat hospitalization, I would do that. So newer drugs have come in, newer modalities have come in, oxygen therapy at home, many things have come. But it's a good question you asked because this is one of the things which people were overlooking. Anemia. All of us think anemia is a simple thing, we'll give some pill and the patient will be all right. It's sometimes as simple as that, but many a times it comes from the fact that the ferritin levels are inadequate. Whatever you may do, you may even superficially say it is 10.5, but the patient is not well. And therefore, in that context, there is a worldwide thinking and rethinking about the use of iron as a constant thing in patients with heart failure. Just as in a patient of heart failure, I will see that they are on a beta blocker, an ACE inhibitor, a mineralocorticoid, or now a sacubitril. All these, similarly, I will look at this.
Sure.
I still remember my late teacher from Jaipur, Dr. Kotia, he, even at that time, he used to tell us that, 3 things are important: thyrotoxicosis, anemia, fever. So true today.
So true today.
So true today. And over these years, I've realized, so even before people started talking in our heart failure clinic, in our heart failure, we routinely will take an investigation. It's not very expensive. But in terms of if it is found to be low and an injection is to be given, in terms of A, the patient's well-being, and B, it helping the patient in overall getting better, I would use ferritin.
So coming to iron therapy, there are 2 available options. Either we could go for oral iron preparations or IV injectable iron preparation. So in this case, what will be your choice, sir?
No, in this choice, here it's always better to give IV, because many of these patients have large hearts, they have tricuspid regurgitation. All these things almost act like, they don't help the absorption of iron so well.
True.
It's like so I would say, because they are hospitalized anyway.
Correct.
So many other things. So I would just say, let us give them, so at least we are sure that the levels have come up. And then we can continue with medical therapy orally.
So does it also help in symptom improvement of heart failure?
Oh yeah,
patients?
absolutely. What you're asking is it helping in amelioration of symptoms? Oh, sure it does. No
the
doubt about it.
6-minute walking test,
Yes.
patient probably will be able to walk more.
Naturally. And also it helps the tachycardia also to settle down.
Okay.
Because there are RBCs flowing out. So I think if I were to single out 4 or 5 things that have happened in the field of heart failure medically,
Right.
there is LVAD and all those other things, transplants, but just medically, by medical therapy, then I would single out as this is one of the things that good you asked me this question, good that some people will see it, good that many of those doctors will also think in terms of IV and in terms of ferritin levels rather than just
How safe are these IV irons? Because the general understanding is that IV iron probably is not very safe.
Well, they're quite safe. I haven't heard of anything. Start slow.
True,
go
because
slow.
in the older days, if I remember my medical school, we were told that iron dextran in such preparation, you need a test dose, they are not safe. But with the current generation like
It's
ferric
different.
carboxymaltose and all, I think they are pretty safe
Yeah,
to
they're
be
pretty
used.
That is the march of science. That yes, at that time we used to think several times about it. Now, of course, we are careful. And
What is the usual dose these patients will need of IV iron, sir?
that will depend upon the levels. No?
So, Are you recommending doing serum ferritin and TSAT in all your heart failure?
No, at some point you will have to do
Okay.
to establish that what their levels are, and then go accordingly.
In symptomatic patients, probably they may be helpful to do.
Oh yes, definitely.
And the guidelines, even ACC and ESC has now recommended that we should do these studies and also prescribe IV iron like ferric carboxymaltose to all these patients.
Yes.
So they have given
No,
great.
now it's a guideline thing.
It's recommended by
What do you
all-
say? Good medical practices,
Correct.
GDMT.
Correct.
So it comes in that.
So what will be your message to large number of physicians who may be sometimes the first point of contact for those patients? How do they approach these patients?
No, my thing is very clear that ultimately these patients will go with their family physicians, who are their closest people. They come home, they have a kind of a rapport with these people. And I think that they should make a timeline where, just as after a bypass every 6 months we do a test, they should also have a timeline and say, look, for example, in ladies who are menstruating, I think, and losing blood, I think that timeline should be shortened.
True.
To help them out. But I think clinical decision making will be important. But having given once, don't forget about it.
Correct. Because even the guidelines recommend repeat investigation should be done 1 to 2 times in a year.
At least.
Once you have reached the required level of serum ferritin and TSAT.
It will only help their patients
Correct.
feel better. After all, there is something called feeling. Instead of we all push, vitamin pills and all, it's a nice feeling that we are giving exactly what the patient requires.
Correct.
So I think.
And iron has been proven as an independent predictor of mortality in many of the studies.
Yeah, absolutely. That's why I'm saying that those physicians who are looking after heart failure patients, what is it? It's routinely we are getting urea, creatine, CBC and all done. Get a ferritin also.
True.
They're not expensive tests.
I think that's a very, very important message which should go down the line, that they should not ignore this as an insignificant condition, because it can have significant impact on patient morbidity as well as quality of life.
Absolutely. I'm in total agreement with that.
Thank you, sir. Thanks a lot for joining and sharing your views with us.